Hi, so today I'm going to explain to you what cryotherapy is because in our next treatment, we're going to be using it. So cryotherapy is the use of any type of cold application to help prevent further swelling during acute injury, decrease pain, and also prevent, stop, or decrease muscle spasm. So when we have the cold application put onto your injured limb, there's going to be a signal sent to your hypothalamus by the cold sensory nerves. Hypothalamus is a region in the brain that controls the temperature of your body. So the hypothalamus is going to get the message that temperature is being decreased in an area, which is going to cause vasoconstriction. So the blood vessels are going to get smaller at the area, resulting in less blood flow getting there. Then 46 minutes later, the hypothalamus is going to realize that the cold stimulus is still happening. So it's then going to cause vasodilation of the blood vessels, meaning the blood vessels are going to open up, allowing more blood to go to the muscles and tissues and bring oxygen, heat, and nutrients. Then 15 to 30 minutes later, a superficial vasoconstriction is going to occur. So what I mean by this is that the blood vessels at the surface only are going to get smaller to prevent more heat from being lost. Metabolic rate is also an essential concept in cryotherapy because metabolic rate is the speed at which, at a normal rate, that your tissues and muscles get oxygen, heat, and nutrients. So with cold application and the vasoconstriction that occurs, that results in less blood flow going to the area, meaning that there's less heat, oxygen, and nutrients being brought to the tissues. This can be really important with preventing further swelling because if there's less blood flow going to the area, there can be less plasma leakage, so less swelling. And also if your injury has a hemorrhage, meaning bruising or discoloration of the area, vasoconstriction can also really help because it's going to mean that there's less blood going to the area, meaning that there's less blood that can leak out, causing that bruising. When we look at your pain, the decrease in pain is going to be caused by the analgesic effect and the gate control theory that I'm going to explain right now. So when you have the cold application on your injured limb, your cold sensory nerves are going to fire like crazy and very, very quickly compared to your pain receptors. And more simply, you have your cold sensors that are like Usain Bolt, and you have your Toyota Corolla that are just an average Joe. They're going to race to reach your spinal cord, specifically the substantia gelatosa, to be able to be sent on to the brain to be processed and integrated. Obviously, the Usain Bolt is going to beat the average Joe to the spinal cord. And since also there's a limit capacity at this region, all the Usain Bolts are going to beat all the average Joes, meaning that only the cold sensory message is going to be sent on to the brain. Also, since there's also a decrease in nerve conduction, meaning that even if there are some pain receptors that get into the body, there's going to be less of them, meaning that you're not going to feel as much pain. Cold also helps relax muscle spasms. Since the cold can slow down nerve induction and the local nerve activity, the brain is going to have a hard time sending the message to the muscles telling them to contract and protect, which results in the relaxation. The sensation that you're going to feel is the acronym CBAN: cold, burning, aching, and numbness. Cold is felt as soon as you submerge your limb in the cold. Then burning is when there's vasodilation, so when more blood flow is sent to the area to help prevent tissue death and bring more oxygen to prevent hypoxia. Then aching numbness is during the superficial vasoconstriction, which occurs after 15 to 30 minutes of cold application. So your role as the patient really depends on the technique I'm going to decide to use. You can either be just relaxing, have your limb elevated. I might ask you to perform a coordinated and controlled strengthening exercise, or we might perform a passive stretch together. There are some safety measures that I'm going to take into account, such as watching your skin reaction to the cold. So doing skin checks once in a while to make sure that there's no tissue damage. I'm also going to do a sensation check to make sure that your nerves can react if the stimulus is getting too intense and too painful. I'm also going to ask you to wear proper attire so I have access to the area. I'm going to drape you to make you more comfortable and also prevent wetting your clothes. And I'm also going to put you in a comfortable position so you can stay like that for the whole treatment time. The contraindications to cryotherapy are altered sensations, skin disorder, psychological issues, a hypersensitivity to cold, Raynaud's, and a pacemaker. But there are also some cautions that I need to take into account, such as dislike of cold, metabolic disease, cardiovascular disease, circulatory disease, systemic disease, and cancer. So if you have any questions about cryotherapy that we're going to be using next week, just let me know and I'll answer your questions.